we have to start looking at our approach as the state, essentially as the client in this program now, and figure out, how do we less micromanage and instead really internalize the fact that all we care about are the outcomes, the healthcare outcomes. Because if ultimately all we care about are, you turn in your forms, your financial reporting forms, for these Fortune 5, Fortune 50 companies, and we don't care about whether or not they're actually incentivized to improve healthcare for the people on Medicaid, I think we've lost the plot. We've lost the plot.
Welcome to We Don't Color on the Dog. Infant mortality, that has been an issue that we have picked up at In Weekly since the Civic Leaders Summit that was held with the Civicon earlier or late in September. We've got with the state representative, Alex Andrade. I know, Alex, you and I have had several conversations. You've really dug into this one as something that you want to work on. Talk a little bit about what you've got ahead of you.
Well, yeah, thanks, Rick. So next week in the healthcare budget subcommittee that I chair, we've invited AHCA, the Agency for Healthcare Administration, to come talk about their new Medicaid contracts, Medicaid 3.0. In Florida, we as a state, we don't directly manage Medicaid anymore. Like, we don't interact directly between patients and healthcare providers. We've essentially outsourced, contracted with these private companies like Aetna, CVS, or Sunshine Health to manage these or more closely like private insurance companies. So these companies themselves, they're the ones who are responsible for managing the care that patients receive when they qualify for Medicaid. And next week, we'll be talking with AHCA, the state agency, about what incentives they have in those contracts to try and drive better healthcare outcomes. Because as a state, we're still responsible for complying with CMS, the federal Medicaid program. And we have to report the financials, how we're monitoring the financials of these companies, making sure that fraud's not occurring. But we also need to report healthcare outcomes. What we discovered last session is this kind of trend where AHCA has really focused on measuring activity and not focused on measuring ultimate outcomes. I think that's for several different reasons, but at this point in 2025 and 2026, we have to start looking at our approach as the state, essentially as the client in this program now, and figure out, how do we less micromanage and instead really internalize the fact that all we care about are the outcomes, the healthcare outcomes. Because if ultimately all we care about are, you turn in your forms, your financial reporting forms, for these Fortune 5, Fortune 50 companies, and we don't care about whether or not they're actually incentivized to improve healthcare for the people on Medicaid, I think we've lost the plot. So next week we'll be talking about that. And I think that specifically with infant mortality, given the fact that, over 40% of mothers in Florida, expecting mothers in Florida, qualify and are on Medicaid, it's a really good service line, target population to have this conversation about. We need to focus more on outcomes and less on, measuring specific activities throughout that process.
Well, the Florida House, and you've shared with me some of the prior legislation, the Florida House has looked at this for a while and has made changes to Medicaid over the years to try to lower that infant mortality rate. Talk just a little bit about that.
Well, yeah. So in 2022, now Senator Aaron Grahl passed a bill. It was HB 5 that year. And HB 5 provided an expansive array of new requirements or suggestions, and also came with funding to, one, try and incentivize hospitals themselves, providers themselves, to focus on one or two of any number of quality measures that they could improve when they're, delivering babies and caring for expecting mothers. We also did a huge push on data collection through the USF Department of Public Health. That's one of the best parts about being in this role is I have access to all this data and information right now. So next week before my committee, I'm meeting with Charlie Lockwood, the dean of the USF College of Public Health and Administration, to get his perspective on exactly what we could do within, especially this Medicaid population, to help drive down some of these rates of infant mortality. I mean, in Escambia County alone right now, 68% of black mothers are on Medicaid and almost 30% of white mothers are on Medicaid. That averages it out to, I think, about 42% of all expecting mothers just in Escambia County alone are on Medicaid. So if we can set up a system or incentivize the creation of a system that addresses instances of, again, bad outcomes on maternal health and infant mortality, we'd have a significant impact. And Rick, thanks to your coverage, I did do a deep dive on this stuff and realized, 25% of infant deaths are due to unsafe sleeping conditions. And something like 45% are due to issues that are preventable potentially in the first trimester, things that lead to, preterm births. Things like hypertension, getting pregnant immediately after giving birth, not having any type of care in that first trimester, not taking prenatal vitamins, those types of things lead to those things in unsafe sleeping conditions account for almost 70% of all infant mortality. And when you look at that and you see, at least on paper, how significantly high the rate of preventable infant deaths are, you can't look at that and not try and do something. And I'm just fortunate that I'm in a position this year to be working on that. So I've had my staff on my committee and the healthcare policy staff in the Florida House working on pulling some information for me. And I think it's going to serve a dual purpose. Hopefully we'll have a better product that further reduces the rates of infant mortality, but it'll hopefully also help reframe for ACA its role in our managed care program overall.
Right. Well, and you've hit on it, Alex. You look at we know prenatal care is important, and that obviously is not going the way that it should. Low birth rate is a product of that, and that's and then the bringing up the sleep conditions, and that they're all big important parts of it. And I think that's what I like, Alex, and this is where I'm really driving, is you have access to the data, and we've got to be data driven on this. Let's don't pretend it's data. It's the real data. I mean, you'll be able to figure out, I bet if we really looked at Escambia County, we're probably looking at maybe a handful of census tracts where these families live, where the problem is. I think we might be able to narrow it down there and really drill into this. But I think we're on the cusp of really doing this seriously.
Yeah, the racial disparity alone is jarring, right? When I realized just how significant the racial disparity on this alone was, my jaw dropped. It was over 13 out of every 1,000 black babies who were born in Escambia County. Unfortunately,
It's a 3 to 1
lives.
ratio between black babies, black infants, and white infants. It's 3 to 1.
And when you're talking about, on average between 30 and 35 infant deaths every year, and you realize just how significant that disparity is, I think you're right on the census tracts, but again, in my role, I have to be looking statewide. I can tell you that rural counties especially suffer from much higher rates of infant mortality than more metro area counties. It was somewhat surprising to me to see that Escambia County more mirrored those types of like rural counties. In South Florida, I'm looking at implementation, right? So if I'm going to do something related to these managed care plans, right, something that's going to affect the entire Medicaid population here in Florida, I have to look at, by region, by community, figuring out the right measures that are outcome based is going to be the critical component to all this. But I'm just grateful that people like Aaron Grahl and Chris Sprouse, when he was the Speaker of the Florida House, it was Chris Sprouse who came up with the idea to expand post-birth care for newborns for mothers who qualified for Medicaid to the full year. Initially, prior to his decision to do that, it was for 2 months after birth they were covered. Interestingly, though, the measures we have are, largely like how many visits did an infant have to their primary care physician within the first 15 months. So we have like these 3 months in the tail end where it's potentially some of these kids don't qualify for Medicaid anymore. If all we're measuring is, did you visit with a primary care physician 6 times or more in the first 15 years of life, I don't think that we're drilling down to the ultimate goal here, right? We're not drilling down to what does and does not prevent infant mortality. And these plans are sophisticated. Like I mentioned to you, I mean, they're Fortune 5, Fortune 50 companies. They own their own PBMs. I know you're familiar with what PBMs are. These companies own PBMs. I don't know why we are still in this place where we are measuring activity, kind of micromanaging what they're doing, instead of simply saying, as the client, we want you to reduce these rates of infant mortality by X in a given year. And in your region, in your population, in the counties you cover, we're going to trust you because we've incentivized you in the right way to drive down these rates in the sophisticated way we know that you manage every other aspect of your business. So long as we put achievable metrics in there and we put sufficient incentives in there, I think we're going to have better outcomes and hopefully continue to reduce those rates that we've seen across the state.
Well, it definitely could be a game changer. I said, Alex, you've got your committee meetings next week. Let's try to circle back maybe at the end of next week or the following week on what you've learned through the committee process.
Sounds good. Thanks, Rick.
Thanks for watching, and to keep up with what's going on, be sure and subscribe. Just click on the little dog to the right and click the subscribe button. You can also like this video and click on the bell, which will notify you of new content. This really helps the channel grow. We appreciate you.